seeing a rapid increase in diabetes, not only type 2 diabetes, but also the fact that it is related to increase in obesity in the country. So with this rising trend of overweight, obesity and diabetes, it becomes very, very important that from a public health angle, we start including communities in these discussions. We do talk about it in the health system, but what is becoming more important is that people are distant from the public health system. So even if they have diabetes, what is their level of engagement in managing their condition is a big question that we are having currently. In our community conversations, we have seen that when we spoke to somebody who is in an urban setup and we asked, what medication do you take for diabetes management? The answer was, एक सफ़ेद गोली सुबह ले लेता हूँ. So not even knowing your medicine somewhere is a failure of the system not to be able to engage the patient in his or her own management. So HRIDAY has started a campaign with Beyond Type 1 to be able to motivate people to look for signs and symptoms. So See the Signs campaign has been contextualized to India so that people can look for these signs and symptoms for diabetes and have early diagnosis and screening. Second, we are also advocating and working with the communities and people with lived condition to be able to take charge of their own health. That is, have regular checkups done, follow your medication. Drug adherence is a very big issue. People think that if they start their medication for diabetes management, they will become addicted to it and they have to take it for lifetime. So we have to normalize it, informing people that this is a chronic condition which requires a long-term management, both with your effective lifestyle, but also with medication adherence. There are a lot of myths among the people that we will not take medication, we will not take insulin, we will manage our diabetes with just home remedies, करेले का जूस पी लेंगे या चीनी की जगह गुड़ डाल लेंगे. But these are all myths which need to be busted, and that is why if we have to reduce the burden on our health system, that diabetes does not cause so much of loss to our health system, to the country's economy, and to individual patients and their families, we have to effectively engage people who are having diabetes.